Hi, my name is Karin Karindi. I'm a general dentist from Estonia, but most of my work is actually root canal treatments. I do root canal treatments and retreatments. Today I wanted to talk to you about my second visit protocol. The thing is that sometimes I manage to do root canal treatment in one visit, but most of the times, or a lot of the times, I do two visits. So the first visit would be a small consultation, x-rays, build-up and gross cleaning. And then the second visit I try to do as clean as possible. So here's my protocol for that. I hope you find it interesting. I start by placing a rubber dam, cleaning the tooth with alcohol, and attaching my Microcopy sterile burr. Also, all the stuff on the tray is sterile, so that's how I try to keep the cleanliness. My temporary filling is usually bulk fill, composite material, because I find that in this way we can keep the tooth integrity, we can keep it as strong as possible after the build-up. And sometimes life happens that the patient they get sick, they disappear for a while, maybe they don't have money to continue in this month, so that's why I use Teflon tape in between, and then I cover everything up by bonding the bulk fill. Bulk fill shows through the Teflon tape, and also I have to stress out for the patient that maybe it feels like a permanent filling, but it is not. And also, of course, I write in the patient records that there is no root canal filling yet. I remove the composite with this long neck round burr, which is my favorite. And then it's really easy to remove the Teflon tape, which doesn't catch the burr doesn't catch the Teflon as it catches the cotton pellet. I haven't used ever cotton pellets, but of course I have discovered them when my colleagues send me referrals. It's really easy to remove from the access cavity. Sometimes it is a bit tricky, but the work is tricky, so it doesn't really matter. And underneath the Teflon tape we see really clean calcium hydroxide medication. I like to refine the sharp edges of the composite filling so that the stuff won't get stuck underneath, so that after root canal filling it's easier to sandblast the cavity. So this is what I do in this first 5 minutes. Then I would of course rinse the root canals with copious amounts of sodium hypochlorite, 5.25%. Really gently, but with a lot of liquid. Next, I would continue with the rotary instruments to clean the canals once more and check the patency. This time I used FKG Shaper, which I like because it cleans the canals in 3D mode and activates the solutions. So this is what I do second appointment. Second appointment usually doesn't take 2 hours, but it depends what prosthodontist wants me to put inside the canal. So usually I am the one who puts a permanent filling on top also. So the second appointment would finish up with root canal filling, and and a permanent filling with or without a fiber post, for instance. Hope you enjoyed. Thank you for watching and have a fun doing root canals.